Alterations in sleep and sensory function. Sleep. We have our REM sleep, rapid eye movement sleep, that occurs about every 90 minutes. Starts about 1 to 2 hours after non-REM sleep begins. Because of loss of voluntary muscle tone in your tongue and your upper pharynx, respiratory obstruction can result in REM sleep. Non-REM and REM sleep alternate during the sleep cycle, with REM sleep increasing in frequency. Non-REM sleep increases just before awakening. But behaviors of REM sleep are rapid eye movement, loss of tone in some muscles, decreased temp, altered blood pressure and heart rate, respirations, release of steroids. And you'll have very memorable dreams, some of which are in color. Non-REM sleep is when you have slow wave sleep. Your behaviors, you'll have a metabolic rate that decreases by 10 to 15%. You'll have a decrease in temperature, heart rate, blood pressure, and respirations. Sleep disorders are classified by their symptoms. Insomnia is the inability to fall or stay asleep, and I think that affects everybody at some time or another in their life. It occurs related to acute stress, long-term drug or alcohol abuse, chronic pain, depression, and medication side effects. Pickwickian syndrome is also sleep apnea. It is when you have apneic periods associated with obesity. Back in Charles Dickens wrote the Pickwick Papers. He had a character that was 5 feet high and 5 feet wide. Now think about laying down with 300 pounds of pressure on your chest and then taking a deep breath. Easy to see why it can cause a problem. It can also be due to a decreased sensitivity to carbon dioxide, upper airway obstruction, change in oxygen tension. It tends to occur more in men than in women. Hypersomnia, sleep apnea, is associated with an upper airway obstruction that occurs during sleep. Behaviors are excessive snoring, multiple apneic periods, low oxygen saturation, pulmonary hypertension, and right heart failure with cyanosis. Somnambulism is sleepwalking, and they've done studies that show that some people can get up and sleepwalk and drive a car. There have been people that have used it as a defense against murder, that they drove somewhere, killed somebody, and didn't even know they were doing it. There have been people that have cooked full meals, eaten them, and cleaned up afterwards, and wondered why they were gaining weight rather than losing weight when they were on a diet. Vision problems. You can have eye movement disorders. Eye movement disorders like strabismus, where one eye deviates from the other when the person is focusing on an object. They can be due to a trochlear or abducens cranial nerve dysfunction. You'll have weak or hypertrophic muscles in one eye. It could be due to thyroid disease or, as I said, neurologic disorders. Symptoms are double vision, diplopia. And here is strabismus of the vertical type. And here is another strabismus. You can see on the left the eye that deviates inward. Nystagmus is involuntary unilateral rhythmic movement of the eyes. It's present at rest or when the eyes move. According to a lawyer, in a case in which I was a juror, there are 85 different types of nystagmus. And some of them could be due to like the cold and or alcohol, among other things. But it could also be pendular nystagmus, which is a regular to and fro movement, back and forth, or jerk nystagmus, which is one phase is faster than the other, so it jerks to the one side and then back. This is due to an imbalanced reflex activity of the inner ear, medications, retinal disease, fatigue, cold, or cervical cord problems. Alterations in visual acuity. We have our amblyopia or lazy eye. This is when you have decreased vision in one eye, pardon me, due to cerebral blockage of the visual stimulus in an effort to have clear vision without diplopia. It can be due to diabetes, renal failure, malaria, or a central nervous system problem. A scotoma is a circumscribed defect of your central field of vision. This is usually due to multiple sclerosis, tumor, pernicious anemia, tact, or tobacco use. And this is showing somebody on the left with normal vision and someone on the right with amblyopia. And now vision with a scotoma. Upper left-hand corner, it shows the visual disturbance. Upper right-hand, no, I'm sorry, lower left-hand corner shows an incomplete scotoma. Upper right-hand corner is the bus, and that shows complete scotoma. And down below, on the right side, is a visual distortion that might occur. Cataracts are cloudy or opaque area in the ocular lens that's due to altered metabolism and nutrients within the lens. It can be congenital or degenerative. It's due to trauma, infection, or radiation. Symptoms are decreased visual acuity, blurred vision, a decrease in color perception, and glare. You may have papilledema, which is edema and inflammation of the optic nerve. This is due to obstruction of the venous return from the retina. It's also due to increased intracranial pressure, retrobulbar neuritis, change in your retinal blood vessels due to diabetes or hypertension. And this is how someone who has cataracts sees. And this is how cataracts change your vision. Notice how the visual field on the one that's at the bottom right shows a scattered visual field with that. This is showing papilledema in the center. You can see papilledema is a specific form of disc edema that results in, this is the papilledema, resulting from an elevated intracranial pressure. Generally exhibits a minimal acuity deficit, but may demonstrate transient visual problems associated with postural changes. Patients with papilledema may also report a headache, intermittent diplopia, vomiting, and or nausea, and a pulsatile tinnitus. They'll hear a ringing in their ear that gets louder and softer and louder and softer. Their visual field defects are very widely affected. You can have alteration in dark adaptation. This is due to aging or vitamin A deficiency, where you need twice as much light to see normally. Now, glaucoma is the third most prevalent cause of vision problems and blindness in this country. Approximately 15 million people have some form of glaucoma. You'll have extremely high pressures that can cause blindness in days to hours due to pressure on the optic nerve. This is the acute type. It is associated with diabetes, glaucoma. You must not administer atropine to patients who have glaucoma because that will dilate the pupil, closing the angle of drainage, and can cause permanent blindness. So glaucoma is an increase in intraocular pressure greater than 20 millimeters of mercury. It causes loss of your peripheral vision, and it can cause permanent blindness. There are three types. Open angle or chronic glaucoma is an obstruction of the outflow of the aqueous humor or overproduction of the same. It's the most common type. Symptoms are insidious. Your peripheral vision is gone before you even realize it. You have a mild ache, halos around lights, and a decrease in night vision. This is showing normal eye circulation, where your aqueous humor continuously circulates from behind the iris into the anterior chamber. As you can see, it comes from behind the iris, back here, and out. Sorry. It exits the eye where the iris and the cornea meet. The fluid filters through the trabecular meshwork before passing into an open channel called Schlemm's canal. And this is open-angle glaucoma, showing blockage of that trabecular meshwork, where it slows drainage of the aqueous humor, which increases intraocular pressure. This is narrow-angle glaucoma, or angle closure glaucoma, where the angle is formed by the cornea and the iris narrows, preventing the aqueous humor from draining out of the eye. This can lead to a rapid increase in intraocular pressure. So narrow angle or angle closure glaucoma is displacement of the iris, closing the angle and stopping drainage of fluid. It may not require treatment unless it causes symptoms. Closed angle glaucoma is acute. It is a medical emergency. You must treat it immediately because otherwise it will cause permanent blindness. Symptoms are excruciating pain with a sudden increase in intraocular pressure, blurred vision, halos, double vision, and nausea and vomiting. Congenital closure is a very rare disease and is associated with genetic anomalies. Accommodation are changes in your thickness of the lens that's needed for clear vision. Presbyopia is changes due to aging. You'll have alterations due to pressure, inflammation, aging, and disease of the ocular motor cranial nerve, but the major cause is presbyopia. You'll have headache, double vision, and blurred vision. Your arms are no longer long enough to be able to read what you're trying to read. Alterations in refraction are the most common form of vision problems. Myopia, light rays focus in front of the retina when looking at distant objects, so you're nearsighted. Hyperopia, the light rays focus behind the retina when you're looking at a near object, so therefore you're farsighted. Astigmatism is due to unequal curvature of the cornea, and so your vision is not in focus on the retina. And the drugs that affect your vision, your miotics will constrict, and your mydriatics will dilate. Mydriatics have a D in them, so they dilate, where miotics do not, so they constrict. This is showing myopia, or nearsightedness, where vision manifests as a distant blur, while near vision remains relatively unaffected. It's caused by the eye focusing on an image short of the retina in the back of the eye. This is hyperopia. Again, showing vision. This means that you usually has better distant vision than near vision. It's very common. In fact, the majority of the United States population is farsighted. Hyperopia tends to mostly affect the young, under 10 years of age, and people 45 and above. So that's presbyopia. The condition is characterized by an eye that is too short in length, or the front of the corneal curvature is too weak. Astigmatism is where you have the corneas are shaped more like a tablespoon, where normally the cornea is shaped more like a soup spoon. You can see normal on the right and abnormal on the left. So it's more of an oval versus a spherical shape, or where one side is steeper in curvature than the other. This creates two focal points for the eye, and this is showing astigmatism. You have normal cornea on the left, you have abnormal cornea on the right. It can occur by itself. It is most commonly found in combination with either myopia or hyperopia, but it occurs when that cornea is warped. Okay, and just a comment, not about astigmatism necessarily, but some people have what's called monovision, and otherwise they have one eye that's for distance and one eye that's for close up. That happens to be what I have. And so it's like a natural bifocal. The brain automatically decides between the two. So at the moment, as I knock on wood, I don't need glasses. Macular degeneration I was just interrupted, so I'm going to start this slide over because I don't remember where I was. Macular degeneration, also called age-related macular degeneration. 1 out of 20 have age-related AMD. It is currently incurable, and you are legally blind within 3 years. It is the most prevalent reason for vision problems in the elderly. Risk factors are being white, over 60, a smoker, having diabetes, or hypertension. There are 2 types. The wet type, you'll have a rapid vision loss because there'll be bleeding behind your central vision. The dry type, the vision loss is not due to the bleeding and it's not quite as rapid. But in both of them, you'll have a blank patch in your central vision that gets worse if it's untreated. And here's showing your normal macula at the back. This is normal. And this is what happens with your dry macular degeneration in the middle. This isn't, the cells of the macula slowly begin to break down. It's diagnosed in 90% of the cases. You'll have yellow deposits called drusen that form under the retina between the retinal pigmented epithelium and Bruch's membrane, which supports the retina. Drusen deposits are debris associated with compromised cell metabolism in the retinal pigmented epithelium. and are often the first sign of macular degeneration. Eventually, there is a deterioration of the macular regions associated with the drusen deposits, resulting in a spotty loss of straight-ahead vision. Wet macular degeneration, you can see on the far right, and again, you've got the normal on the far left, occurs when abnormal blood vessels grow behind the macula and then bleed. There's a breakdown in Bruch's membrane, which usually occurs near drusen deposits, and this is where the new blood vessel growth occurs. These vessels are very fragile and leak fluid and blood, hence they're called wet, resulting in scarring of the macula and the potential for rapid severe damage. Straight-ahead vision can become distorted or lost entirely in a short period of time, sometimes within days. Wet macular degeneration accounts for approximately 10% of the cases, but causes 90% of the legal blindness that occurs. Alteration in color vision can be inherited. It's usually male. It is X-linked, and you end up colorblind, so you can't distinguish red from green. External eye structure disorders, like blepharitis, is an inflammation of the eyelids. Hordeolum, or stye, is an infection of your sebaceous glands. Conjunctivis, or pink eye, is an inflammation of the conjunctiva of the eye due to bacteria, virus, chemical irritants, or allergies. Symptoms are tearing, redness, photophobia, scratching or itching sensation. It requires meticulous hand washing and antibiotic treatment because it's highly contagious, and if you have it, you're sent home from clinical, school, work, wherever you may be, because nobody else wants it. There are different types. You can have acute bacterial conjunctivis, which is due to Staphylococcus, Proteus, or Haemophilus. You can have viral conjunctivis, which is due to an adenovirus, or trachoma, which is a chlamydial conjunctivis, which is the leading cause of preventable blindness worldwide, and it's due to poor hygiene. Fomites are contaminated objects and direct human contact. You'll have people who go to the bathroom and don't wash their hands, and they have their hands around certain parts of their body parts. And this is what conjunctivis looks like. Conjunctivitis. Retinal detachment is a tear or break in the retina with accumulation of fluid and separation from underlying tissues. Symptoms are a floater, flash of light, or a curtain over their vision. It occurs if you're diabetic, have sickle cell disease, or extreme myopia. It is a medical emergency for the eye. You must get to your eye doctor, because if it is not treated within 24 hours, it can cause blindness. Hearing problems. Otitis externa is a swimmer's ear. And now we have over 30 million Americans with hearing problems. And there's a chart on page 323 of your textbook that lists the different causes of hearing problems. We're going to do just a few. Otitis externa is where you get inflammation of your outer ear canal due to bacteria. Symptoms are inflammation with itching, swelling, clear to purulent drainage, tenderness when the pinna is moved, which is your outer ear, is the pinna. Otitis media is an infection of the middle ear, tends to occur mainly in children. Symptoms are earache, fever, hearing loss, ruptured eardrum. Risk factors are allergy, sinusitis, or cleft palate. Conductive hear loss is a change in your outer or inner ear that impairs conduction to the inner ear. Symptoms are decreased hearing, so your voice, the person who has it, is very, very soft because they hear their own voice as very, very loud. It can be due to an impacted cerumen or wax in the ear, foreign bodies in the ear canal, benign tumor of the middle ear, otosclerosis, Paget's disease of the middle ear, and things of that nature. Sensory neural hearing loss is impairment of the organ of corti. The loss may be sudden or gradual. Symptoms are tinnitus or tinnitus, whichever you prefer. High-tone sensory neural loss. The most common type is presbycusis, which is hearing problem due to aging. But it could also be due to trauma, infection. It could be congenital or hereditary. It could be due to Meniere's disease, hypothyroidism, environmental factors, or neoplasms. Mixed hearing loss is a combination of conductive and sensory neural. Functional is very rare, but it does not respond to the voice. They appear to hear but don't respond. It could be psychologic. Selective is what I know my father had. And I tend to think, please don't be insulted, guys, but I think it tends to be a guy thing. Because I could be in the living room talking to my dad. He's in the chair opposite me, and he'd say, what? 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 I could be in the dining room 2 rooms away telling my mother maybe an off-color joke, and he would hear every word. Selective. Think about it. You're not going to find it in the textbooks or on the test. Proprioception is awareness of the body and its body parts. It depends upon impulses from the inner ear and reception from joints and ligaments. It is affected with neurological deficits and or problems with your inner ear. Vertigo is the sensation of spinning. Meniere's disease is a type. This is a disorder of the inner ear. Cause is unknown. Could be to trauma, could be to an infection. Symptoms are hearing loss. It's a violent rotary vertigo. You feel like you're going round and round in circles. Tinnitus, nausea, vomiting, pallor, sweating. It does tend to be episodic. It can cause permanent hearing loss over time. And Alfred Hitchcock did a great film called Vertigo, where you can actually see how Jimmy Stewart felt when the room went around. That's another movie I recommend. Olfaction, problems with it. Hyposomia is an impaired sense of smell. It's oftentimes due to a central nervous system problem. Anosmia is the complete loss of smell, and AN means without. Olfactory hallucination means that you're smelling odors that are not really present, so they could be an aura before a seizure. Parasomia is where you get an abnormal or perverted sense of smell, where instead of smelling a rose, you actually smell fertilizer, or vice versa. Taste. Hypogesia is a decrease in taste sensation. It results from cranial nerve injury or following a tracheostomy because your sense of smell is a part of your taste sensation. Agesia is the absence of the sense of taste, and this is due to a central nervous system problem and will affect someone's appetite. Paragesia is a perversion of your taste in which substances possess an unpleasant flavor. In other words, somebody may give you a piece of chocolate and you taste vinegar, and that is very unpleasant. And that finishes the senses lecture.